So we first came into First Light because of an experience with my mother. I do not have a healthcare background at all. I'm not a clinician, but I've been in the position where I've been a child making a concerned call for a parent. My background is actually mergers and acquisitions. I'm an MBA, which is the exact opposite of what we're doing now. But a few years ago, my mom got sick. She had cancer, and she was visiting my siblings in Utah. We're from Boston, and she fell. And during that process, while she was going through chemo, she fell and she broke her femur. So she had to go into rehab. And while she was in rehab, she fell again and broke her shoulder on the opposite side. And so at that point, we learned that the chemo had metastasized and that she was a fall risk and she needed a lot of care. And I didn't know what a caregiver was, what a CNA was, what an LPN was, what an RN was, but I knew that there were these nurses that were coming into my mom's room every day that we loved and trusted. And I really felt like they were taking care of us emotionally and my mom physically. Sorry. So we started hiring them because we didn't want to restrain my mom at night. So we started hiring them, and my mom kept saying, I want to go home. I just want to go home. And at that point, I had the realization that my mom was never going to go into the home she loved again. That so much of what made her comfortable and familiar and that she loved was now gone. And it's simple things like she wouldn't be surrounded by her bookshelves anymore with the books she loved and the painting that she and my father got on their honeymoon, and the neighbors that would pop in and the trails that she loved to walk. All of those things that were so familiar to her were now gone. And so I started researching how to bring my first Google search into anything with home care was how to bring someone home to die. And that's when I found home care, and I researched it for about a year and a half before I even brought Lindsay into it. I wanted to make sure that I knew all about it, and it's my background too. Before I even brought Lindsay into it, I interviewed 4 home care companies, and then together we interviewed another 3. So we interviewed 7 before we decided on First Light. And so we really did our research before we did. And it's great because it was too late for my mom, but I do feel every day we're making a difference in the lives of people just like my mom and children just like us.
It's a very fulfilling industry, and I'm so grateful to be a part of it. And I'm glad that Dina brought me on board. I come to it with a little bit different perspective. I don't have any home care or healthcare background either, but I worked in an assisted living community as a teenager and I loved it. And I always tell people at my graduation, I had 9 residents in a row with like
Mhm.
signs cheering for me. And I loved it. So I'm so happy that this is where my career has landed me again. And I love we do different things in the business, but I get to talk to the new clients when they call in on the phone, and I get to talk to the daughters. And my personal association with home care is my mom took care of my grandma for 5 years. And during that time, she couldn't really come out and visit us. It really impacted our relationship in a negative way. She's not as close to my kids as she is with my sister's kids who live down the road because she couldn't travel and she wasn't able to travel. So I love to talk to the families and be like, if you can get the help, it will increase your quality of life, make you a better wife, a better grandma, etc. So we love what we do and helping people every day.
Most of the folks I talk to do have some kind of story that is had brought them to this decision to open a home care agency. And your stories are both very touching. And I would agree that also if I were taking care of my mother here in my home, it would be really hard for me to go visit my kids and their children, my grandchildren. Who are you going to leave her with? What are you going to
Yeah.
do about that? Are you going to take her with? That's the whole thing is right. So allowing the adult children to live their lives and to be an adult child and not a caregiver is so impactful, and to help people get back to home who you didn't think were going to be able to get back to home. That's crazy good. That's so nice that I know that, like you said, it was too late for your mom, but so many people just want to go home, and they can if they have the right resources and they have the right people to talk to.
And even as important as getting back to home is staying home.
Yeah.
Mm.
Yes, not having to worry. And also, I think The whole fall thing, I know there's tons and tons of research about senior falls. I think that being in this business for a long time, many of us will realize that once somebody falls and breaks their hip, and they may fall and have a small injury or a little thing, but when that starts happening on a regular basis, or they have a traumatic injury that requires surgery, it's time. It's past time to start looking at how to make their home safer, how to make them safer, and to get some help in the house, I think. And falling it's hard for us as adult children to realize that something else might be going on just because grandma fell or our mom fell, but she didn't really hurt anything this time. But it's a sign, it's a signal, not a little fall, but it keeps happening. So, yeah, so tell us, when an adult child or any family member for that matter, or a senior calls your offices, they call you, they come through your website, however they find you, when that happens, what can they expect? What happens? What's the process? How do things get started?
Sure. We've trained everybody in our office to be able to take those intake calls and help families. So we try to just listen, right? Step one, just listen to their story, listen to what's happening, listen to the stressors that are going on, and then first of all, address the stressors. Let them know, I hear what you're saying. It is so stressful. I talk to people all the time in your shoes that are going through this. And guess what? We can help. We can provide a little bit of respite care. And then we just give them the opportunity to ask their questions. Ask me whatever questions you have and I'll answer. And if we can't help you, I'll point you to the person in the community that I'm friends with that can help you. Let me just be a resource for you. So we've trained everybody in the office to listen first and then allow them to ask questions. And then we'll answer the questions as they come to us. But I feel like the families that call do have some standard questions that they ask. First, they always want to know the price, and we are very transparent here. We do give that to them over the phone and explain like the whole process and assessments. They want to know like what services that we offer, and we list those. And so often it's things that they didn't even think of, and they're like, oh my gosh, your caregiver will make meals. That's amazing. That would really help. My dad only eats peanut butter and jelly. So going through the list of services helps them see more and more value that could be added into their loved one's life, but their life also.
Yeah, and then we go out and we do a free assessment at their house. And that's great because they get to meet the team in the environment that they're most comfortable in. And then we get to see the environment that the caregiver will be going into, or the nurse. So we get to cater care directly to them. Our assessments are free. There's no commitment, and it's personalized to everything that the client needs. It is personalized directly to them.
That's amazing. I would imagine that you get a lot of comments after care has been going on for a little while. I should have done this a year ago. I should have done this 2 years ago. We should have done this a year ago. Ugh, I can't believe how much stress has been lifted off my shoulders. I don't have to be here every single day. I love my mom, but I can come every other day or on the weekends. We're her caregivers, but during the week, it's nice to be freed up. Imagine that you guys hear that a lot, the amount of relief that folks feel that there's somebody with them when I or the adult child can't be there. So that's great. So you do the assessment, somebody goes out to the home and does the assessment. And then I know one of the questions that we hear a lot is, how soon can services start? And what is that expectation? Everybody's a little different.
Yeah, we always tell families that we can start same day if needed, but we like a 1 to 2 day notice. So that's the way that we word that. But we do hire every single week. We're a big operation. So we try to always have the staff necessary to sign any client same day when needed.
Sure. I think a notice is great. And then continuity of care, we also get that question a lot. I know most home care agencies strive to try to keep the same caregivers, the ones that you like, with the family. I also know that sometimes everybody needs a day off, and sometimes, somebody else is available. So how do you address those kinds of things? Can they have the same caregiver, or is it usually a team of 2 or 3, or how does that work?
Yeah, we staff in teams of 2 to 3, exactly what you said. They'll have a primary caregiver who will be responsible for the care plan. And so they'll be the ones coordinating with the other caregivers as well. But to your point, the reason why a team is so important is because people do go on vacations or they get sick. We used to really focus on that one caregiver, one client model, but COVID was a game changer for that. And as important as that one caregiver is, and certainly they are, the consistency of care is what's important. And so that's where the care plan comes in. That's where the coordination. We're doing supervised visits in the client's home every 60 days with our client care coordinator. And she's monitoring to make sure that there is that consistency of care. And here's the benefit too, is that you want to make sure mom and dad, especially if they're post-op or if they have memory care, that they do have consistent care. That means that it's really the best thing for them is to have 1 to 2 caregivers that come in. Now, many of our clients have primarily one caregiver, but we always make sure that second caregiver, maybe third, depending on how often it is always trained and ready to go in seamlessly.
That's great. Yeah, I think the 2 to 3 caregiver model where you see a couple of faces that are familiar, 2 or 3 faces, and they all know what's going on here. I think that's the best way because you're right. People need a break, or they're sick, or their child is sick, and they're not able to work today. So having that model is great. I know COVID changed a lot of things about the way we work in home care and in healthcare in general. And so I know another question that folks have is, what are the minimum number of hours that we can have care in the home during the week? Is it 4, 8? What's the minimum?
Yeah, we try to make ourselves a little different than the competition. There's a lot of home care companies in Denver, and we feel like every senior should have the opportunity to get home care services in their home. We used to have a higher minimum requirement, but the truth of the matter is sometimes they only really can afford 1 shift a week. So we changed our model almost immediately after we opened to just 1 shift a week, 1 3-hour shift a week. And that way, when someone's budget doesn't allow them to get more care, they're at least able to have eyes on them, have a wellness check, help them in and out of the shower. So we do keep that minimum low.
And that's nice. And I will say, I know that is not easy to do. So it is a testament to your commitment to your community and also your caregivers' commitment.
It's hard from a managerial standpoint in the office sometimes to have a lot of little clients, but we do feel like it's the right thing to do as human beings and business owners. So we've just kept it that way over time.
It's hard because caregivers want to work a full 8 hours, and you have to do a lot of logistics when you have short visits.
Yeah.
But the fact that you're willing to do it is really nice. I've just talked to somebody else who was willing to do those short shifts because sometimes it is just the shower and the grooming once a week or twice a week, or just getting that grocery shopping done, or just there's some little things that and having eyeballs on that person at least once a week is really nice, even if they're doing pretty good. So commend you for that, because I know that is not an easy thing to do. So the fact that you do it is a big commitment. So thank you for doing that. It is hard for people to afford 8 hours of care every single day. There are people who do that, but sometimes it's what we can manage.
Yeah, we do that also. We do have clients that are 12-hour shifts, 8-hour shifts, overnights, 24/7. So we can do anything in between.
That's awesome. That's part-time care, full-time care. That is great that you guys are able to do all of that. What else do you think folks would want to know, or what other questions do people ask you when they call on the phone, or you're in their living room and you're doing that big intake? What is on their minds? Is it background checks and safety, or what else comes up?
I feel like those questions definitely come up. They always, when they're first doing their research, they always want to know about the strangers coming into their house.
Yes.
And I put strangers in air quotes because they're not strangers for long, right? But for the senior citizen, it's really scary. And they always have lots of questions about our hiring process, our training process. Who are these people coming into our homes? And we love to let them know we're nationally accredited. We train to the high, like we pull background checks to the highest degree. I think it goes back like 7 years across multiple states. We run their name on a national database of caregivers. We do all sorts of different things here as an accredited agency to make sure that they are getting a safe person that they can trust in their home. But we also always let them know too, if you don't like someone, you can call us. Not everyone's personalities match. So they have a lot of say in who their caregiver is, and they have a lot of say as to their schedule and what time they want their shifts to be. So as long as they communicate with us, we'll find somebody that they like. But I do think questions about the caregivers and the training process and hiring is on almost every single phone call.
Oh yeah, safety, stranger danger, and of course
Yeah.
the only likes to tell us about all the negative, crazy things that happen in the world, not all the beautiful, wonderful people that are out there committing themselves to be great caregivers. So talk about training just for a minute. When a new caregiver comes on board, every state's a little bit different in how they in the requirements for someone who's walking into the house. Sometimes they have to be CNAs or HHAs. Sometimes they don't. So what is the criteria and what do you guys do for training?
Yeah, it'll depend on their diagnosis, their ICD-10 code, whether they get a caregiver or a CNA. Some clients just prefer a CNA, and a CNA is just a different level of training. But because we have our ACHC accreditation, we train above Colorado state standards. So we train above federal standards too. So every caregiver that goes into your home has had hands-on training prior to entering your home. Not only have they been background checked and drug tested and all of that, but the quality of training they have is double the standards that are required, which we pay for because we feel like if they're getting great care, then they're happier. And not only does that training happen before they even enter your home, then they're taking reaccreditation courses throughout the entire year. We also have a memory care program because so many of our clients are trained in memory care. And memory care is not just redirecting, it's realizing things like their motion, their sensors are different. Like that coffee cup that they've been picking up for 50 years, suddenly they've lost the ability to pick up the coffee cup in the same way. And our caregivers are trained to aid them so that they can regrip that and learn how to do something that's been so basic to them. But it's not just the physical care. There's also an emotional component to this because you've had someone who's lived their life independently for 7 to 8 decades, and suddenly everything is changing for them, and that's scary. And so we also train them in the emotional care, which I think is really important, so that they're truly a companion. And one thing that we really emphasize is that a change in condition. Suddenly, and this is why the consistency of care is so important, suddenly Mr. Smith, who our caregiver has been seeing now for 7, 8 months, comes in and you've noticed that there's a speech pattern that's a little different, or he's walking a little differently. Our caregivers are trained to look for that. And then we're communicating with their children or their spouse to say, we have this concern now. So we take our training very seriously because it's making a difference in the home. And we have mentors that are going out all the time. One of the things that was important to Lindsey and I is that we were caregivers. We volunteered to be caregivers for almost a year before we even bought the company. And so we understand what it's like to make what they were making. We know what it's like to be a caregiver. We know what it's like for the training. And it has changed our perspective in our business. Like we're not just business owners. We've been there. We know what to look for the clients. We also know what to look for the caregivers to keep them happy too. And a happy caregiver gives happy care. And that's so important.
That is great. I didn't know you guys worked in the business as caregivers
Yeah.
for a while. That is
It was
amazing.
for a franchise neighbor.
Yeah,
Oh,
and
my
like
goodness.
even little things like there's certain terms that in the beginning we would giggle when we would say them, and now we're like, we can talk about what our caregivers can talk about. It was really a great experience. Hard. And that's the point. It was hard, and now we understand that.
Oh yeah. Oh, absolutely. That's hard. Those shifts are not always, it's a lot. It can be a lot of work in one shift. 8 hours can fly by because you are moving and doing stuff around that house that needs to get done and helping the client and being their friend and being their companion. And there's so much to it. Yes. It's makes it's hard on the body, and it's also taxing up here. It makes you tired. But it's such a rewarding part of this whole home care business, is seeing the happiness of the client and their family. So that's awesome. That is something that definitely, it's lovely to hear that. I know that owners often will fill in a shift or do this or that, but to have worked for a while in this business is pretty great. You really.
I'm going to give an example of how it makes us different. Lindsey was a caregiver for a client who we love. We started off caring for his wife, and now we care for him. And he was just in rehab. And she and her family go visit him all the time, even in rehab. And we're about to get him back. And literally, as her caregiver, he's become family to you. He would go to her son's football games with them.
Yeah, I couldn't avoid what I'd adopt every senior dog, and that's not comparable to, and I would have those people come to all our family stuff. I couldn't help it. Yeah.
Yeah.
My husband would be like, what, who's that? What's happening?
It's easy to love
Oh,
people.
yeah. Oh,
mean,
they're so full
I
of
feel like
great
that's the
stories.
easy part of the business.
Yes, that is. Yeah. That human connection will never go away. That need for human connection and socialization. So that's so great. You guys are amazing. So yeah, thank you for doing what you do and serving the people of your communities. And speaking of that, tell us all the places that you can serve in your franchise.
Sure. So we have one physical office location, but we cover 5 different FirstLight Home Care territories. So we go all the way up north to Thornton. Only people listening to this who know the Denver area.
Right, the Denver area.
And then all the way down south to a couple zip codes in Highlands Ranch, out east to Aurora to C470. And then we cover a couple mountain towns also on the west side. So we'll go up to Evergreen or Morrison. So big territory. Basically, Dina always says everything that the light touches.
Yes.
My family and I were hiking once, and we were at a mountain, and we saw some seniors hiking down. And I was joking with my family. I'm like, everything that you can see here, we can help them.
That's great.
So big territory.
That's great. So you guys are a big home care agency. That is amazing, because that is a huge territory. The Denver area, obviously, you know it better than I do, but it spreads out the metro area is quite large. So
It is. It's big.
it's amazing. Thank you. Thank you for being on the show, telling us your story, telling us how you do business and what folks can expect when they call your office. I really appreciate that.
Thank you for having us.
You.
Cool.